Dr. Diaz, can you tell us a little bit about some of the procedures that you'll do?
Sure. We plan on covering the whole spectrum of orthopedic procedures, covering about 90% of all orthopedic procedures. That will include state-of-the-art arthroscopic procedures, arthroscopic reconstructions, knee replacements, hip replacements, half knee replacements, shoulder replacements, and reconstructive procedures. We will also be covering the emergency room in Oswego Hospital, providing greater services in terms of trauma. We have a trauma team that we're developing that will be able to handle more complex trauma, more complex injuries as time goes on.
So, Dr. Diaz, you were one of the first, if I'm not mistaken, the first robotically trained orthopedic surgeon. Can you tell us a little bit about that?
Sure. I had the opportunity several years ago to become involved in robotically assisted half knee replacements and full knee replacements. And I was the first surgeon in central New York out of Fox Hospital in Oneonta to perform the first robotically assisted knee replacement. We first started with half knee replacements, and now I've expanded my practice to include performing full knee replacements utilizing the robotically assisted Navio system.
And you spent 22 years of your career in Oneonta with Bassett Healthcare. What drew you to Oswego in the community?
Yes. I spent 22 years with Bassett Healthcare, working in central New York out of Oneonta, Cooperstown, and the surrounding areas. And my children are in college at this point, and so my wife and I are empty nesters, and this represented a wonderful opportunity to do something novel, which is to create and expand an orthopedic program and make it something which is state-of-the-art. And so I'm very excited to venture into this program and develop something that really is special for our community.
So we've spent a lot of time talking about teams. And so between the PAs and your orthopedic partners, tell us how you function as a team to cover the ORs, the ER, the floor in this office.
Yes, we do have a team of 4 orthopedic surgeons at this point, and we will be adding more physician assistants as well. And at this point, we all work together to help cover the emergency room, but also our local population. So we all spend time being on call for the emergency room, which means you're responsible for trauma, which comes through the emergency room. And we all are developing our niches in terms of either being more sports-oriented or total joint-oriented or perhaps more trauma-oriented. So as time goes on, I see us developing our individual little practices to a greater extent where we can help treat our community in even greater detail with greater quality.
And right now, we're standing closest to where the digital x-ray will be. Tell us a little bit about how that fits into the practice and makes it more comfortable and efficient for the patients and for you.
Certainly digital x-rays are the future and certainly has been the mainstay of treatment. I remember the days many years ago when we would run around with x-ray files and have to put them up against the window to see the x-ray. So the quality and the speed by which the x-rays can be obtained is far better than it used to be in the past.
Diaz, one of the advanced procedures that you do that's more progressive is the PRP and stem cell procedures. Can you tell the people a little bit about that?
Sure. I've always been fascinated by biological materials that can be utilized to help treat arthritis and orthopedic pathology. About 4 or 5 years ago, I became interested in utilizing stem cells and PRP, or platelet-rich plasma, in an attempt to either retard or stop the arthritic process in knees and perhaps even try to regrow some cartilage, or at least make the cartilage somewhat healthier than what it was. And so I developed a procedure which I performed over 100 surgeries with, which seems to be quite satisfying and seems to be show great promise for the future. So I also intend to bring that to our local community and help with that aspect of it. Let us not forget that 20 years from now, there probably will be no joint replacements and that everything will probably be biologics to some extent.
And so historically, folks may have heard about this on SportsCenter as you look at NFL athletes or other athletes that have gotten these. So you're now making it accessible to the local community, and this is an emerging trend, right?
That's an excellent point. The rest of the world is so far ahead of the U.S., unfortunately, in developing a lot of these programs. And I'm sure you've heard of athletes who travel around the world to receive these novel treatments in order to extend their careers and to improve their function. And these are the types of procedures that I would like to bring to our local area with the experience that I do have.
So the other day, one of the groups that Dr. Diaz and I presented to was the board of directors for Oswego Health, and you mentioned something about access. Tell us a little bit about how access has allowed you to grow your career over the 22 years at Bassett and do 250 plus joints a year.
Yeah. Clearly, access is always the point. Nobody likes to wait 4 to 6 weeks to see an orthopedic surgeon when they have injured themselves or are in pain. And so we're doing everything that we can to improve access so that patients don't have to wait that long to get in and see a professional, and that they can be treated in a timely fashion with quality care close to home.
And at Oswego Health, we recently opened up what's called the Referral Center. This is a center that helps support the medical staff, the private practices, and employed physicians within the network to ensure that we get timely care in the most appropriate setting. This is a progressive trend within healthcare, and it just makes it a bit easier and a bit more centralized for folks to get taken care of. So, Dr. Diaz, you've joined the community and you're currently living in Oswego. Tell us a little bit about your time and your wife's time in Oswego as you moved into a new community.
Oswego has been absolutely wonderful. We've absolutely fallen in love with the town. It's a beautiful, wonderful town. The lake is wonderful. The people have been absolutely perfect in terms of accommodating and welcoming, and we could not have had the best 6 weeks that we've ever had moving to someplace new. So we thank everyone, and we look forward to staying here for a long period of time. My plan is to finish my career here and provide all my services for the rest of my career in Oswego Health. And I do ask for your support, and hopefully we'll be able to provide the services that are needed for our community. Well, we thank you for your time, and we look forward to serving you at the Center for Orthopedic Care in Fulton.